Dr. Prasad batchmates during our MBBS. He is having an illustrious academic career. Soon after our MBBS, when he appeared for All India entrance, he secured 11th rank, and he joined the prestigious institute of JIPMER. He completed his pediatrics from there, was a gold medalist, and after that he did his DM neonatology from the same institute. This time also bagging a gold medal. He is an examiner to DM and DNP courses of neonatology. He worked in Hyderabad Rainbow Hospital as a faculty for a short period. Then he was in Trivandrum HA Hospital. Now he has come to his hometown, Kannur. Welcome, Dr. Prasad, to weekly CME of Kannur Evening.
Good evening. We'll discuss some common problems of neonatology. Nothing related to ICU, only in the OPDs. And most difficult for a general practitioners to manage, especially diaper rash, infantile colic. So diaper rash, which I call nappy rash, ammoniacal dermatitis due to irritant dermatitis and exposure to urine and stools. And problem is that it is very painful. So each time when baby is passing motion or urine, baby will start crying. Okay. So usually the skin creases are spared. You can see the skin creases that is spared, and this way can escape from candidal infections. So in diaper rash, usually the skin creases are spared and it escorts supramucous candida infection. Usually candida infection, skin creases also important. So how do you treat? First you have to explain the parents what is the problem. Best thing is to avoid diapers, but most of the time it won't be possible in the night. So if they are using, you have to change it frequently. Once the baby passes urinary motion, within 1 hour, you have to put a new one. And the question will be, which is best? Most of the time they will ask, which brand I use, which is best, like that. So best thing is avoid, but if you are using, some brands are found to be useful, right? It is not Indian brands, KUMAR, Bella, some companies. I'm not promoting, but my personal experience is that some brands like KUMAR or Bella, if you are using that, it will be less. And most of the incidents happens like with some companies, especially fabrics. Anybody is using fabrics, if once they develop, it will be very severe forms. I'm not downgrading them, but my 8-year experience, most of the times the babies are getting exposed due to fabric brands and really very severe forms. So if you are not able to avoid, better to change the branch. Nothing is available, then better to avoid this fabrics. Then, and the best thing is to heal. How will you heal? It's exposure to air. It is possible, you can keep a small fan and keep the bottom exposed to the pinch. Once it's exposed to air, it will heal fast. Then should advise some mother or grandparents not to wipe so much. Once you wipe it, the epithelialization will be delayed or impaired. So use some cotton cloths like a banyan cloth and just touch and remove the water. Do not wipe. Then can use in zinc oxide creams or even coconut oil also. If you are using prophylactically, coconut oil or zinc oxide is better. But problem is zinc oxide it won't stick much. So once next time baby is passing normal motion, everything will be washed out. So you have to apply, tell the mother or grandparents to keep it applied frequently. So zinc oxide creams are good. So when you use antibiotics or any other creams, sometimes they'll be applying it in the home. You see now, before now, so many things are there. The mother or grandparents will be using that, is not improving. Then what you have to do? Generally, you can use a combination then. If it's not improving the zinc oxide, you can use a combination of antibiotics and small amount of steroids, which are some creams contain small amount of steroids and antifungals. So that is the one option. So within 2 to 3 days, usually it will heal. And you can combine with other liquid paraffin, so many things. But especially if you not respond to zinc oxide cream, then you can apply the combination therapy. Okay? Small amount of steroids, antifungals, and antibacterials. So this is the Candida albicans. You can see intertrigus areas mostly it is affected. Then the confluent erythematous flax will be there. Sharply demarcated edges. So you can see satellite lesions. Pustules on continuous areas of skin. Here, skin folds are also involved. So I will treat at same. You have to apply. Remove the water. Apply micronizal cream or powder. You can or current or stain. You can say combination drug with a small amount of steroids. In our areas, mostly we use a combination that is vertebral, but I prefer one cream is called surface SN. That contains antibacterial, small amount of hydrocortisone and antifungals. Most of the babies, 99% of the babies respond within 2 to 3 days. Then you have to address the mother regarding diet. Sometimes some allergic drugs or excess cow's milk, even some Ayurvedic medicines they will be taking. That's all. Green these things, then kashayams. All these things also can cause some irritation locally. So we have to address the mother to avoid all these things to heal. Then even in heals also, probably the recurrence chances are there. So we have to address the mother also. Prophylactically they can use zinc oxide or coconut oil. Then frequent changes of the napkins. So another common problem is staphylococcal infections. Staphylococcal infection can be pustulosis, impetigo, or even staphylococcal scalded skin syndrome also. So you can see the pustules. So 3 to 5 days old babies with the Lala. This gives pustule with erythematous waves. So it is an diaper area, periumbilical areas, lateral aspect of chest, neck, all this. So treatment is the antibiotic, either clostridium or a cephalosporins. In some more severe forms, there are blisters and ruptures quickly. It's called bullous impetigo and becomes superficial rounded oval erosions. Here also we need systemic antibiotics, clostridium or cephalosporins, because suddenly baby will go for sepsis and even shock can be done. So, and one is a seborrheic dermatitis. Usually it's a late manifestation. After 1 month, baby will dull. It's called cradle crack. We see yellow scales on a erythematous base with a minimal pruritus. Itching will be less for seborrheic dermatitis initially. You can see face, eyebrows, and scalp called cradle cap. So, it's localized or general. Usually it is localized. 90% is localized. Severe can lead to fissures and become secondary infections. Causes, as you know, it's a yeast, Pittosporum ovale. So how will you treat? Can you say shampoo and olive oil in the scalp? So soften the clusters. Then can use mild steroids, 1% hydrocortisone cream if needed. So much itching it causes fissures, then you can use 1% hydrocortisone cream also. But the problem with olive oil, Some days mothers will apply so much olive oil. This can lead to pigmentations. The baby may suddenly become black. Then parents become panicked. Usually, it's found to be irreversible. So oil application that leads to pigmentation is usually considered as irreversible. So when you are applying for olive oil, you should give a warning. Sometimes your baby may become black. That's the usual question mothers ask. My baby is born, baby was white. Then after 1 or 2 weeks, baby become black. So what will be the ideal colors? So usually we advise like that. Then baby is born as white, but they will develop pigmentation only by end of second weeks. So by the end of second weeks, what is your baby's color? That will be the brown tone. And this is the most common questions. My baby was black, you put phototherapy or exposed to sunlight, then my baby becomes suddenly black. Usually, in the children, pigmentation comes only by the end of second week. So, there is a method. Then, atopic dermatitis. So, atopic dermatitis and seborrheic dermatitis shares the clinical features. Only thing, atopic dermatitis is rare in newborn and itching will be intense. It is very difficult to distinguish during the neonatal period. And here, pruritus, irritable scratching and rubbing against nearby objects. And usually, diaphragm area is spared in atopic dermatitis. And recurrence usually occurs. Same dry white scaling and strong family history of atopic. Treatment that use more of moisturizing emollients and same time hydrocortisone you can use if in severe itching or fissures develop. And any superimposed infection that will treat the infection. Okay. This is one common condition called erythema toxicum. It's a benign condition. 50% of term babies will have, and it's rare in preterm, but preterm it can come later. At the end of 2 weeks, come like a pustules. Basic lesion, small papule, evolve in the pustule with a prominent halo of erythema. Pustule with erythema. Can be few to numerous, usually on the trunk, and palms and soles are always spared. And it disappears itself. It's an allergic response to Verneuil's ratios. Then next one is a common condition of Salmon patch, the nevus simplex or macular hemangioma, small hemangioma. That is 40% of infant developed is a distant derma capillaris. And crying makes more prominent. So most of the mothers are telling, once my baby cries so much, baby become red, face become red, can be to Salmon patch. The glabella is called angel's kiss. The nape of neck usually can persist. Once they are removing the hair, it will appear more prominent. So much red spots will be there. That's called dog bite. Can persist also. Most of the time it can disappear by 1 year, but it can persist also. And one is a bottom stain called nevus flammus. Most common on the face, can be on the trunk also, and usually on the unilateral. Is pink and macular at birth. With the time, it can darken and reddish purple. As we have called the Stewart-Weber syndrome or Klippel-Trenaunay syndrome. Treatment is a pulse laser therapy if needed. So most common other one is a strawberry hemangiomas. Bright red, eyes and well circumference. Usually, it may not be present at birth, and it evolves usually by 3rd or 4th weeks. It's more common in preterm babies, IUGR babies, and infant of diabetic mother. Preterms up to 1% of babies can see hemangiomas. And grow up rapidly during 1 to 6 months, continue to grow till 1 year. More common in head, neck, trunk, and more common in premature babies. Usually by 4 to 5 years, it disappears itself. What are the complications? It can be due to ulceration or secondary infections. If it is near the eyes, it can affect the vision also. And it may be in the liver, DAT, lungs, CNS, anywhere else can be associated also, but it's rare. So one more is a nevus sebaceous. Sometimes you can see a plaque like this, the scalp or face. So it's excess sebaceous glands and malformed hair follicles will be seen. Problem is that it is not like other condition. It can lead to malignancy. Benign or malignant tumors can arise in 15% of the cases, usually after puberty. So This case, you have to invest sebaceous, you have to give treatment. Before puberty, you have to do an excision. Sometimes basal cell carcinoma can develop. Sometimes capillary spots, light brown, round over macros, and smooth edges, vary in size. And it won't resolve with time. Increase basal keratinoid size. 1 or 2 or less than 5 cannot be there normally also, but in a very large number, you should be careful. Can be associated with neurofibromatosis or tuberous sclerosis also. So, if you are seeing large number of these things, you are giving consent for sterilization, sometimes problem can arise. So, if these things are there, you have to do another test also. No other viscera involved or family history is not there, then only you should give consent for sterilization. The Mongolian spot is a common one. 90% of blacks, brown, grey, or blue macros commonly in the lumbosacral areas. It won't disappear, only thing color will fade. The infiltration of melanocytes fade within 1 to 2 years, but completely normal won't come. Some discoloration will be there. Then some babies develop like this, sucking blisters, very clear blisters. The lip, fingers, and or wrist. That is due to friction of repeated sucking. Can present even during birth also, because in the intrauterine pedicel baby start sucking. So during birth also these blisters can be there. That's called sucking blisters. So it usually resolves spontaneously. Okay. This one is a cephalomatoma. It's a traumatic delivery due to prolonged second stage of labor, either instrumental delivery, especially vacuum, can do to anxiety on the parent. Sometimes periosteal swelling also can be. And the boundaries are limited by suture margins. Usually it doesn't cross the midlines. Treatment is reassurance. Usually it's resolved within 4 to 8 hours. But you should not miss the anemia or jaundice part of that. Usually he is very calcified. So after the end of 1 month, it becomes very stiff and tight. So one question mother will ask whether I will do massage or during bath whether we can do massage. So best thing is to advise them avoid massage the first 1 month. Still become very hard. After that they can do massage if they are worried so much. But by the end of 2 months, it will disappear completely. Then some babies will do eye sepsis. You can see purulent eye discharge. And you have to take swab, gram stain and culture. Sometimes this purulent discharge like this comes, it can be completely destroy the eyes and cause permanent vision damage. You have to see other systems involvement. If respiratory system is involved, chlamydia should be rolled out. Then other one is a blocked nasolacrimal duct. So here usually eye discharge will be sticky, but it won't be purulent unless the secondary infection occurs. You can do a nasolacrimal duct massage. Most of the time, mothers will do massage, then they will stop, then reappears again. So best thing is to give advice that you can continue the massage till 3 months, at least 2 or 3 months, so it won't recur again. What about skin? Usually intermittent strabismus is normal in the first 3-4 months, especially when the baby is looking at extreme sides. Then any misalignment after 4 months should consider as abnormal. Paralysis is always abnormal. If the baby having a flat nasal bit, sometimes pseudocin also present. So anything goes after 4 months, it should lead to ophthalmology consultation. What about preauricular sinus? The remnant of first branchial cleft. So small opening will be there. Can be associated with other anomalies also, renal hypoplasia or hearing impairments. So that to advise surgery if there is a discharge, infection or an abscess formation. But surgery, best thing is to postpone till 4 years of age. Fluorescent skin tag, usually isolated, removal indicated for cosmetic purpose. This also can wait till 4 years and do a cosmetic removal. Torticollis is also one concern of parents. Baby is looking one side only, not moving the head to other side. Usually is diagnosed late 1 to 2 months, and most of them they will attribute to vacuum or some other birth injuries. So here you should be careful. And maybe palpable tumor will be there 3 to 4 weeks after treat. Otherwise, may lead to facial asymmetry, plagiocephaly, and amblyopia, complete loss of vision if untreated. So you have to exclude facial impairment as underlying cause, then advice for physiotherapy and release of deformity. Depend on the protocol. Some they will do by 6 months, some places they will do 1 year. This is one more normal condition called ranula, cystic swelling from the floor of the mouth under the tongue. So mucus retention cyst, most of the time it disappears spontaneously, causing so much problem, hospitalization, surgeries may be needed. These are the one more common condition. Most of the breastfeeding babies or bottle feeding babies also develop. The white card like plaques on oral buccal mucosa extends to parents. It's adherent and difficult to scrape off, especially if the baby is developing some infection and getting antibiotics like cephalosporin. This candidas will be a big problem. It can affect the feeding. So they have to treat with antifungals, micronazole or nystatin. I have to check the mother also, varicose salts. These are common conditions, umbilical sepsis. You can see the periumbilical erythema, edema, and discharge. Here, hematogen spread will be there to liver, portal vein, phlebitis, and later it can lead to portal hypertension also. So you have to do a parental antibiotic therapy, culture everything. Then this is one more common condition called umbilical granuloma. The granulation tissue at the base. Soft, granular, dull, red or pink. And sometimes you will see seropollen secretions. So how do you treat? Usually, water restriction with the common salt. This is common salt mixed with coconut oil, apply and wash it off after half an hour, twice in a day for 2 weeks. Most of the time it will disappear. Then next option is silver nitrate. Still it's there, then you have to do for a surgical consultation. Previously, copper sulfate used to use, but because of the toxic content, nowadays copper sulfate is not advised. Only common salt and silver nitrate. Still not responding, I have to ask for a pediatric surgery. Then another one is a umbilical polyp. It's a ramanta vitalo-intestinal duct. It's a brown, white, red. You can see a polyp. Then surgical excision of the entire vital intestinal brachial remnant should be done. Before that, you have to do a dye injection and see the complete vitalo-intestinal tract and have to do an excision. What about umbilical hernia? Usually, imperfect closure or weakness of the umbilical ring. And when the baby is crying or coughing or straining, it will protrude out. Usually, surgeries are not indicated. Only thing you have to rule out hypothyroidism and check for a hypotonic, Down syndrome or some other anomalies. Nothing is there. You can observe for 3 to 4 years. Surgery is indicated only after 5 years. After 4 years or 5 years, if it is not doing correction, can rarely can become strangulated. Presently, surgery is advised only after 5 years. The hormonal withdrawal, maternal hormonal withdrawals, the mucoid vaginal discharge. I have to advise some mother not to manipulate too much, just to have to wash with water. Should not wipe, otherwise may lead to secondary infections. Then this is the hormonal withdrawal effects. Another one is gynecomastia. Sometimes mother will ask whether we can express the milk or we can do a massage. That is not to do, may lead to secondary vital infection, especially staphylococcus. In this milk production, for which is milk should not be expressed out. Other one is the bleeding periods called pseudomenses. Here, I have to just reassure the parents. Then scotocelian cytosis, that also common in newborns. So transluminant, painless, and can able to see palpate above the surface. So it resolves spontaneously. Surgeries indicate usually after 2 years. This is another concern, inguinal hernia. Here, scrotal groin mass, so flexion, increase during crying. Sometimes can be reducible. This is strangulated, not reduced. Here, you have to do immediate surgery is advisable. Risk of strangulation is very high, especially in preterm babies. So, two conditions usually in the preterm babies will do immediate surgery. One is inguinal hernia, Another one is a cardiac infrared diaphragmatic TAPs. Both are advisable to do immediate surgery to avoid complications. Then undescended testes may be incompletely descended or ectopic. So, present recommendation is if both sides are involved, you have to do as early as 3 to 6 months. This depend the anesthetic illness. The single side you can wait maximum of 1 year. Before that you have to cut. Bilateral you have to do early, 3 to 6 months you can do. Unilateral you can wait maximum of 1 year. Then you have to give tell us the fertility. Even if you do surgery also fertility may be impaired. Another thing is the chance of tumors. They to advise that also. Another thing is the phimosis. Phimosis is common. Up to 90% of the babies less than 3 years have phimosis, and it slowly results in childhood. Only recurrent UTI is then excess pressure. Then you have to do a circumcision. Hypospadiasis, urethra opens the ventral aspect of the penis. Usually associated with caudate, the ventral shortening causing ventral bend and shaft. It's an absolute contraindication for circumcision because you have to reconstruct later. So one more concern is once they went home, they will develop prolonged jaundice. So usually after 2 weeks, preterm or terms should not have a jaundice. Term 10 days is the maximum, preterm 14 days is the maximum. So prolonged jaundice, what can be the cause? One is the breast milk jaundice. Some unidentified substance in the breast milk that causes jaundice. Then you have to always rule out hypothyroidism. Then one more concern is urinary tract infections. Then biliary atresia. You have to look whether it's a diet fraction, that is obstetric jaundice or non-obstetric jaundice. Then rarely neonatal hepatitis also can cause. The most common of the breast milk jaundice. So you may have to stop the breastfeeding 1 or 2 days and observe. Usually it will become normal. You have to do a liver function test, urine protein culture, and thyroid functions. One more concern is the neonatal pyrexia. Usually, except the first 2-3 days, babies won't develop pyrexia in the first 1 month. They will go for mainly hyperthermia. Temperature rising usually indicates a severe infection in the first 1 month. So, any hyperpyrexia, you have to exclude severe infections. You have to admit for monitoring of temperature, investigation, routine blood, urine, CSF, chest X-ray, everything you have to do. Then IV antibiotics, culture is data. Pyrexia room for feeding is usually an explosion diagnosis. So always first diagnosis should be sepsis. Then colic, this is the most difficult things to manage. Most of the time, unexplained bursts of crying will be sudden, uncontrollable crying. Usually lasts for 1 to 2 hours, mostly in the late afternoon or evening. So usually begins from 2 weeks to 4 weeks and stops only by end of 3 or 4 months. Exact cause is uncertain. So main thing is that you have to reassure the parent and make sure no organic cause is there. The treatment first is they explore the medical causes. Then possible to identify, as I told previously, you have to identify anything in the maternal food that causes allergens or irritant, like some kashaya, Ayurvedic medicines, even excess cow's milk mother is taking, some soya, like that. In excess spice, that also sometimes some places they use excess spice for the mother. That also can cause. Then how to treat? First you have to treat the parents on. Most of them they will be very anxious, very difficult to counsel them. Then can work. Avoid under and overfeed. Not underfeed and overfeed also. Then keeping the baby in prone position, abdomen press most of the time helps. And can advise carefully. Can keep the baby in the prone and can sleep also. They can sleep for 1 or 2 hours, but with supervision. And simethicone drops usually helps for small amounts. 50 to 60% cases, simethicone drops you can try. And the massage, generally you can do a massage and make the baby sleeps. Other things are dicyclomine, everything, and antispasmodics are not advisable and can do more harm. Then nasal stiffness, usually babies will have relatively narrow nasal passage and obligatory nasal space. So you should not clean out the nasals, only if needed can use a saline nasal drops. Usually it won't affect the feeding, otherwise well baby no need for any treatment. Thank you. Usually, like no one is built to handle the body. Usually, is maintained the body. Yeah, I don't know organic cost, right? Yes, all body is like some set price. And that is something. Usually, open is same. Other things are there. Other things are there. Usually, one to do. Checking, but I don't know.
Anyone else? Or we will run the session?
We Kannur may express our sincere thanks to Dr. PRASAD KUMAR for his excellent and informative session on common neonatal problems of clinical practice. Thank you, Dr. PRASAD. Also, I thank all members of Kannur for attending today's event. Thank you.